So these three exercises I'm going to show you are to do at home and to help you remember the details of how to do them correctly, how to evaluate for yourself if you're getting it correct while you're doing it. So they're the three motions of the hip: hip flexion, hip abduction, hip extension, that we're going to go through. So I'll start with hip flexion. You do that on your back. If you need a pillow, you can use one, but the key thing you're going to be paying attention to is across the front of your pelvic bone. So on either side, that protuberance right here is where you're going to put your hands. And we're going to practice the motion of lifting each leg and keeping this level. So we want this to stay level. So the three things that you do to remind your body that you want the stabilizers to stay still here while the limb moves are: you contract the front of your pelvic floor like 20%, as if you had to pee, but just about 20% of a maximal contraction. You pull in your belly button and you push your sacrum just a little bit into the table, and you'll feel that these muscles between your belly button and your pubis contract when you do that. So you do all of that first, and then you lift the leg. I'll do the right, up, and then as you breathe out, down. And go kind of slowly when you go down. Breathe in, and then out. And to start, usually I'll give you 6 to do, and then you can increase with time as long as you can keep this even. So on this side, I set it up: pelvic floor, belly button, push the sacrum into the table, breathe in, lift, breathe out, back down. And the kind of the natural position for your leg when it's swinging forward, when you're walking, is that it turns out just slightly. And so that's the way to use your leg when you do it. You don't have to keep your toes straight, just let it turn out a little bit. And so you'll feel muscles here working and the deeper flexors through here. This should stay level. The second one is hip abduction, and for that it's good to have something for your head because you're going to lie on your side. So you want your body to be straight, shoulders up and down, straight up and down. So like this, bottom leg bent, top leg straight, so this is a nice straight line. And then you want to raise this leg up this way without using muscles here to like hike your hip up. So you put your hand here by the pelvic bone again, and you don't want it to come up towards your shoulder when you do this. So the things you do to help you remember: you pull in the belly button again, contract the pelvic floor like before, the front part, then reach with your heel to see how this will go down just slightly when you reach, and bend your ankle to about 90 degrees, reach with the heel, and then keep reaching as you lift. You come up only about this far so that this stays where it belongs. These muscles right here are going to be doing the work. And then as you breathe out, you come back down nice and slow. Think of it like floating down like a parachute. Breathe in and up. Breathe out and down. Keeping these muscles active, making sure that you don't hike your hip. And then, and to do the other side, you just change positions to be lying on the opposite side. The third one is hip extension. So that one, you're on your stomach. So for this, the motion's going to be to raise the leg. That's hip extension. So to do that and not have the pelvis rotate again is the goal. And so this needs to stay flat here. And if you're not using these muscles properly, the opposite side muscles of the back are going to try to help. So the three things that you do in this one are similar. You contract the front of the pelvic floor, you pull in your belly button, and you push the pubic bone into the table, and that gets your glutes to get ready to work. But the bones of the pelvis, you're not tucking your tailbone under, you're just pushing straight down into the floor or table. And then you breathe in and raise the limb, breathe out and lower it. You're monitoring back here to make sure these muscles are not working. So I set it up, I push into the table with the pubis, pull in the belly button, contract the pelvic floor, then I breathe in and lift, breathe out, back down. Breathe in and lift, breathe out and back down. You can do both together after you've been practicing to get more strength and be sure that you're maintaining a stable core while you're raising your legs. If it's too hard to do, just flat like this, if your back doesn't bend backwards very well, you can put a pillow under your pelvis. Which makes it easier. You still do the same thing, but it's just not as hard to get that leg up. But if you still have trouble doing it with a pad underneath, then we'll do it standing. And with this, you could use like your kitchen counter, something about this height. And you lean forward a little bit. And then what you're trying to do again, pull in the tummy, pelvic floor, and then you reach back with your heel. And this, you should feel it here and here, working. But this should stay quiet, and you have kind of a circumferential, stable trunk to hold still while your leg moves.